Every cat vomits once in a while, but what if the moment you are brushing it off as a hairball is actually the only warning your cat can give before something more serious takes hold? Most people ignore the earliest signs because they look harmless, but the truth is that cats hide discomfort better than any other pet. Vomiting can be a clue, a pattern, or a loud message disguised as a small mess on the floor. Today we uncover what your cat's stomach has been trying to tell you. Now let us get into point 1. Point 1. How to interpret vomiting the right way. Vomiting in cats is common, but common does not mean normal. One of the biggest misunderstandings among cat owners is the belief that some cats are just natural vomiters. Veterinary research shows that while isolated vomiting can be harmless, repeated episodes often signal an underlying issue. Before deciding whether a case is mild or concerning, context is everything. When a cat throws up, the timing matters. Vomiting immediately after eating often points to fast eating or food incompatibility, while vomiting hours later may suggest inflammation or digestive irritation. You also need to observe the appearance. Undigested food usually indicates regurgitation, while yellow foam or clear liquid can be related to bile, stomach acid, or an empty stomach. Hairballs are expected occasionally, but frequent hairballs often indicate excessive grooming, stress, or motility problems. Always pay attention to your cat's behavior afterward. A cat who vomits and acts normal may simply have had an isolated episode. A cat who hides, becomes lethargic, refuses food, or shows discomfort could be signaling something far more serious. Understanding these distinctions helps you react before a small issue becomes a bigger one. Point 2. Low risk versus red flag vomiting. To judge whether your cat's vomiting is low risk or a red flag, frequency is the first place to look. A hairball once every few weeks is expected, especially for long-haired cats. Vomiting once a month without any other symptoms can be within normal limits. But anything weekly or more, especially without a clear trigger, needs attention. Cats have highly sensitive digestive systems, and frequent vomiting is not their version of normal. It can be an early indicator of food intolerance, stress, infections, inflammation, or early organ changes. Next comes pattern recognition. Timing after meals helps differentiate simple regurgitation from digestive illness. If your cat vomits while eating or right after, it may be gulping food, reacting to bowl shape, or struggling with the food formula. Vomiting hours later is more concerning, because food should have already moved through the stomach. Observing what comes up matters just as much. Bile suggests stomach irritation. Clear fluid could be acid buildup, and foreign material or worms are immediate emergencies. By using frequency, timing, and appearance together, any owner can quickly judge when it is safe to observe and when it is time to call the vet. Point 3. Hidden signs before and after vomiting. Some of the most important signs surrounding vomiting are not the vomiting itself, but the small behavioral changes before or after. Cats are masters of hiding discomfort, so early clues are subtle. Skipping meals is one of the biggest indicators. Cats are routine-driven and rarely break predictable eating patterns. If your cat suddenly refuses breakfast or walks away from the bowl despite usually eating at that time, it can mean nausea, pain, acid buildup, or emotional stress. Skipped meals can even cause vomiting due to stomach acid accumulating. Weight loss is another sign owners often overlook because it develops gradually. A cat who vomits frequently may begin losing muscle mass, especially along the spine and hips. Subtle posture changes also matter. Cats who feel nauseous may hunch, curl tightly, repeatedly swallow, lick their lips, or avoid being touched around the abdomen. These signs often appear before vomiting and serve as early alerts. Another important detail is litter box behavior. Straining to urinate or defecate while also vomiting can indicate blockages that require immediate attention. These combined clues tell a fuller story about your cat's health and should never be ignored. Point 4. Emotional triggers that cause vomiting. Not all vomiting has a physical cause. Emotional stress plays a powerful role in feline health and can easily trigger vomiting, even in otherwise healthy cats. Cats rely heavily on environmental stability, so disruptions in routine, noise levels, or household dynamics can cause genuine physical reactions. A common example is food insecurity. When a cat fears that another pet will steal its food, or that mealtime is unpredictable, it may overeat quickly, leading to regurgitation or vomiting shortly after eating. The arrival of a new pet can also disrupt the social hierarchy and create anxiety. Even well-meaning introductions can cause emotional tension that manifests physically. Loud noises, construction, visitors, a new baby, or even a shift in the owner's work schedule can affect a sensitive cat's stomach. Overgrooming is another emotional response that leads to increased hair ingestion and frequent hairballs. Cats use grooming to self-soothe, but stress can turn a healthy habit into an excessive behavior with digestive consequences. Recognizing emotional triggers is important because the solution is not medical, but environmental and behavioral. Providing safe zones, predictable feeding routines, and reduced competition can dramatically reduce vomiting caused by stress. Point 5. Medical conditions behind persistent vomiting. While mild cases of vomiting can be harmless, persistent vomiting can be a sign of underlying medical issues that require professional care. Inflammatory bowel disease is one of the most common causes and often appears alongside diarrhea, weight loss, and inconsistent appetite. Food intolerances are also frequent culprits, even when the food is labeled premium or sensitive stomach. Cats can react to proteins, additives, or processing methods. Senior cats are at higher risk for chronic kidney disease and hyperthyroidism, both of which can cause vomiting. Parasites are another serious concern. Roundworms, tapeworms, and other internal parasites irritate the digestive tract and may cause vomiting, weight loss, or visible worms in the vomit itself. Toxin ingestion is also a major risk. Plants like lilies, common household cleaners, human medications, or even essential oils can cause sudden vomiting and require immediate veterinary intervention. Hairballs can occasionally become dangerous when they form blockages instead of passing normally. Repeated dry heaving without producing a hairball is an emergency sign. Medical vomiting should never be diagnosed at home without proper testing. Blood work, imaging, and stool analysis are essential tools to uncover hidden causes early. Point 6. What you can do right now. If your cat is vomiting more than you feel comfortable with, there are several steps you can take right now while you monitor the situation. First, begin a simple log. Write down the time, appearance, frequency, and behavior before and after each episode. Vets rely on patterns, and this information can drastically reduce the time needed to reach a diagnosis. If your cat eats too quickly, switch to a slow feeder bowl or divide meals into smaller portions throughout the day. If stress or competition might be contributing, create separate feeding areas, especially in multi-cat homes. Cats need to feel safe during meals to avoid overconsumption driven by anxiety. To help with hairballs, increase fiber and omega-3s through appropriate food or supplements approved by your veterinarian. Regular brushing also reduces the amount of fur that enters the digestive tract. Most importantly, follow the rule of frequency. Vomiting more than once a month, especially in cats over 7 years old, should lead to a vet visit. Early detection through routine blood work and exams prevents complications and gives your cat the best chance for a healthy recovery. Vomiting is not a personality trait, and it is rarely something to ignore. Cats communicate through subtle signs, and every episode carries a message about their body or environment. When we learn to look at patterns, behavior, timing, and emotional context, we understand our cats on a deeper level. This awareness allows us to act before small issues grow into difficult medical problems, giving our cats a safer and healthier life. When you pay attention to the clues your cat leaves behind, you build a relationship based on trust and genuine care. Monitoring changes, adjusting routines, and seeking veterinary help when needed are acts of love that shape your cat's lifetime wellness. If this video helped you understand your cat's health better, join our community, leave your story in the comments, and be part of a group that puts feline well-being first.